You're listening to Happier Healthier, a podcast presented by Conway Medical Center. In each episode, we bring you expert conversations and actionable strategies to help you navigate your health and well-being, fostering a happier, healthier life for yourself and your loved ones. Welcome back to another episode of Happier Healthier. Today, we are joined by Dr. Shannon Phillips with CMC Orthopaedics to learn more about the evolving world of sports medicine and the unique physiological considerations in treating female athletes. Join us as Dr. Shannon Phillips, a former competitive runner and sports medicine physician, shares her invaluable insights on injury prevention, the often overlooked signs of overtraining, especially in females, and the critical importance of energy balance for athletes of all ages. We'll explore the specific challenges faced by pediatric athletes and highlight why a holistic approach to athlete care encompassing both physical and mental well-being is paramount for empowering female athletes to reach their full potential. And we are excited to announce that CMC Orthopaedics is officially open in Surfside Beach with Dr. Shannon Phillips at the helm. Dr. Phillips provides expert non-surgical orthopedic and sports medicine care for patients 2 and up. Dr. Phillips specializes in concussion management, scoliosis care, joint injections, injury prevention, and ultrasound-guided procedures. Walk-in appointments are available. Visit us just off Highway 17 North in Surfside Beach. You can call 843-347-8041. That's 843-347-8041 for more information. This podcast is made possible by the CMC Foundation. Their impact in our community is truly transformative. Think about this. Since 2005, the CMC Foundation has funded over $700,000 in mammograms for underserved individuals. They've invested over $200,000 in scholarships for CMC employees continuing education over the last decade, directly strengthening our healthcare workforce. And through the CMC Smart Snacks program, they've supplied over $559,000 in provisions to Horry County children. The foundation also provides crucial support like over $8,000 for cancer patient transportation. These are just a few examples of how they actively enhance the health and quality of life for individuals in our community. Well, actually, let's start with you. Let's start with your experience as a female athlete.
Okay. So I started running at a really young age competitively. So joined my first track team when I was 7 and was pretty much just like hooked from then on. I don't really know why. I had tried a lot of other sports, but for some reason, I think it's because I'm not super coordinated and really, as long as I'm just running straight, I'm not going to hurt myself. Hand-eye coordination was not a good thing for me. Um, and then I just continued to roll with it from there. And I ran my first half marathon by the time I was 11. And I was just training really hard and had a lot of volume and intensity for someone at such a young age. I had my first stress fracture by the time I was 9. And by the time I was 12, I had 5. So, just a lot of really intense training and was an elite athlete from a very young age, junior Olympian and all this stuff until high school, until I couldn't really do it anymore.
Were you being told by coaches, train this much, go this far?
I was, but there just wasn't a lot of education, or as much as there is now, at least. I still don't think there's enough, but coaches don't intentionally try to injure their athletes. They want to see them succeed. And for me, it was the same thing. Like, I had a trainer that was training me specifically for very specific events, and she was great, and it was successful for a long time. Like, I was hitting really fast times and winning a lot of races and things like that. But at some point, it just becomes too much, and especially at that age where I was really at the height of my training, right around 12, so that preteen age. For females especially, they're just very vulnerable because their body's going through a lot of changes with about to start menstrual cycles, and it puts them at a really high risk for injury and for something like energy deficiency syndrome, um, with all the training that they're doing. And so for coaches, I think that there's not a lot of knowledge around it. At least there wasn't then. And so, and back when I was training that young too, it was losing a period or not having a period was almost, I don't want to say a good thing, but it was something that nobody really was concerned about. And I remember hearing things too at that age, like, oh, so and so started her periods, like she might slow down now. And I don't, that might not be exactly what they were, trying to say, as in like, oh, it's over for this athlete, but as a 10 or 11-year-old, like that's what I heard.
Kind of what you're alluding to is what we then, I mean, not then at 11, but a little later on, kind of knew as the female athlete triad, but is now REDS. Can you kind of go into how has that changed? I mean, I know we'll go into breaking down what it is, but why has the name changed and the thought process behind? Because I would think now it's a little bit more, you know, people wouldn't say things that are so blunt as to say your period will ruin your career as an athlete. So what do you think has changed? We'll kind of start there. That was a loaded question.
No, it's okay. I think awareness has changed, and from the sports medicine perspective, like I mean, sports medicine is a newer field of medicine anyway, too. I mean, it's been around for a long time, but I think as far as developing things, specialties of medicine, sports medicine is one of the newer ones, and so there's a lot of things within that are we're still learning a lot and developing our knowledge base on. So one, I think just from a physician standpoint, like us learning more about it, but also being able to educate coaches and parents and involve them in athlete care, I think is the biggest thing that's changed to raise awareness with it. But then also just female athletics in general, I think have in the last few years have taken a turn where we're starting to focus more specifically on that population as a more vulnerable population as well.
That is kind of the age group of is it the US Women's National League that you're a part of? What kind of led you to join that and what is your role as a physician?
So the women's national league is a little bit older of an age group. I've worked with some of 16-year-old, 17-year-old within them too. And it's the US women's soccer national team. But I've also it's more so like higher teens to early 20s. And with them, I kind of got lucky, honestly, being able to work with them. I One of my fellowship trainers is a part of their program, and I expressed my interest in being able to work with female athletes in the team, and she helped me um, get into it. And then after once I got started, I kept going back, obviously, because it's wonderful. It's a great experience.
So are you like on the sidelines? What is that like?
Yeah, so usually it looks like so they have training camps throughout the year, and sometimes those are like pre-CONCACAF, which is the big tournament for them. A lot of times they're training camps that are getting them ready for like their version of the World Cup and things like that. And so it looks like me going to those training camps, which usually are anywhere from like 10 to 14 days long, and just assisting with them from I mean, they start at 6 a.m. and then go all the way to like 8 p.m. in the evenings. And so it's a team effort is what that looks like. So everyone in the US soccer corporation works together to support the athletes. So that's athletic trainers, that's, equipment and supply personnel, it's admin, it's me, it's every coaches, everyone. And just everyone kind of tailoring and working together to, anything from setting up a training practice. And yes, I'm on the sidelines the whole time during their training to getting them ready for competitions and being at the games as well. At a lot of the times, the athletes that I'm working with at that age are already very knowledgeable about those areas, and I'm getting them for a really specific piece of their training. Like a lot of them are at high level education schools that are kind of already in not I don't want to say programming, but teaching them how to approach injury prevention and things like that. But of course, I'm also promoting those things as well.
What from that are you bringing to treating female athletes?
They are more prone to specific types of injury based on their physiology. So, one, the female athlete triad, which I touched on a little bit, now known as REDS or Relative Energy Deficiency in Sport. And so, we changed the name because we know that not just females can get it, males can get it too. Females are just more likely to get it, because of our menstrual cycles and the hormone regulation and all the other things that we have going on, especially in a developmental stage of growth. And then they're more likely to get ACL injuries, about 8 times more likely than males. And then they're also more likely to get concussions, especially in soccer.
So, how do you think the education has kind of changed around teaching? Maybe it starts with the coaches on, you know, when is training at an elite level overtraining? When is that fine line of, this is preparing you to win versus this is hurting you? How is there like a conversation from physicians?
Um, it's a good question because it varies for every athlete. So I think the best thing that for education wise that we can tell coaches and parents is knowing your athlete. And then I think for athletes too, there's a lot of fear around injury when your identity is wrapped up into your sport. There's a fear of being taken out of your sport because you're starting to get injured or if and so I just think that a lot of athletes also don't report things right away. Like if they start losing their menstrual cycles or just start, it's not even just a loss. It's like they increase time between cycles or your cycles shorten and then eventually then they go away. And that's what we call amenorrhea. Um, but there are certain warning signs that we try to teach and also just encourage athletes to let them know that like, hey, like it is a big deal to lose your menstrual cycle, especially for females. Like we think about it as a vital sign. Like it's like a heart rate and a blood pressure, right? Like you need this to support like all of your bodily functions. And when you start to lose it, it does matter and it does matter in training outcomes. And just because you're getting there, it doesn't mean we're going to shut you down every time, and I think that's the biggest thing for athletes to understand, but also coaches and parents too, because they want the success of their athletes. And so recognizing signs, one, of course, in females, it usually starts with amenorrhea or dysmenorrhea or, increased time between periods, things like that. Um, but then there are also things that are really subtle, like you might be more susceptible to colds or upper respiratory infections because the immune system is not functioning as well, or increased fatigue. Maybe you can't tolerate certain workouts as well as you could before, and it's more consistent. And so it's a fine balance when you start stepping into that overtraining realm, and being able to know that balance for every athlete. It's hard, it's tricky, and so um, just being mindful, I think, and just knowing that these things exist and can cause this type of illness and injury is the best way to educate. That was a long answer.
No, that was a really good answer. Um, what about the athletes? I think, especially with running, and I obviously have never played soccer, but I assume it's similar, where running is painful. Like most sports, if you do them over and over, there are aspects of it that's doesn't feel amazing all the time. But how do you educate your athletes, especially kind of those high achievers that are go, go, go? They're not gonna take a break. They're used to being in pain. When is the pain not normal?
Yeah, that's a really good question, and that's one of the issues I think, especially with the Rett syndrome, when we see it a lot in elite athletes, because to your point, they're used to running through pain, and so a lot of times you'll hear sports physicians say there's a difference between being hurt and being injured. And normal, like hurt pain or training pain, is pain that goes away within 24 hours. It's usually less than 4 out of 10 on a scale or mild in perception. And it shouldn't be consistent, shouldn't keep returning. It shouldn't influence how you're structuring your workout too much. I mean, there's obviously nuances to that too, but pain that is sharp and severe and consistent is definitely pain that is something to pay attention to. And I think there is, and this isn't, again, not always intentional, there can be a lack of insight on the athlete's part when they are used to training at such a high level like that, and kind of flushing down pain that oftentimes they don't really realize it's there until afterwards. And then that's something to be aware of too. Like if you're having a lot of pain in specific areas consistently after workouts, those are things to look out for as well. And of course, pain that's associated with specific injuries or specific traumas. So treating it, I think the biggest thing to remember is that it's multifactorial. So when you're treating REDS, you're um, essentially just trying to correct the energy imbalance. And so ideally, you get like a sports dietitian, and then you have the physician who can monitor labs. Like we do a whole assessment to make sure like vitamin D is really common to be low in athletes because even a normal vitamin D in an athlete or is can be low compared to somebody that's not an athlete. Like athletes need more. And then you have also mental health providers and things to help, or therapists, maybe even to help the athlete if there is associating eating disorders, but also just navigate the mental health ramifications of injury itself. Like I said, injury, I mean, your sport is wrapped up in the identity of an athlete, especially elite athletes. And so it's hard to be told you can't do something that gives a lot of your life meaning. And so um, it's completely reversible. That's the good thing. And then it just takes, a tailored approach to correct that. And sometimes that looks like weeks to months if we could catch it early enough. But if you have an athlete that's, you know, not, for example, not had a period for years, it can take longer. So, and then of course, if they have stress fractures, there aren't a lot of things that I completely shut athletes down for, but stress fractures is one of them. And um, that's extreme cases. I mean, a lot of times, we actually try to keep the athlete moving because it does help with motivation and the mental health component of healing it, which is huge. Um, and so it might look like, decreasing volume or cross training, but again, I think a lot of athletes are afraid to come forward because they don't want to stop. And as sports physicians, we know that. Like most of us were athletes too, and we don't want to tell you to stop. Like that's worst case scenario for us. So most of the time we try to keep you moving.
I wish I had heard that when I was younger because I was so afraid of that too. And so many athletes are. And I feel like you just don't know. You just don't trust that somebody will have your best interests at heart, especially a physician. And I think hearing that is, I don't know. I think it could be so helpful to so many athletes. What are some of the things that are specific to pediatric or super young athletes?
Um, Things that are specific. You mean like injuries or?
Yeah, things that kind of you have seen in your time treating younger kids.
Okay, yeah, yeah. So pediatric athletes, I think most of the times when well, I see similar injuries to adolescent athletes. They're just managed a little bit differently. So you still get overtraining or overuse syndromes. A lot of times in adolescence, they can be a little bit more extreme, like stress fractures and things like that. In peds, where you don't have complete fusion of growth plates or complete development of growth plates, you get something called apophysitis or apophyseal injuries, which is essentially just inflammation of the growth plate. And so the growth plate, if it's overused a lot, can separate a little bit and get inflammation in it. And so it's almost like a pediatric, not completely developed bone version of a stress fracture. But it's a similar type of pathology. It's also an energy deficiency issue. They're not taking in enough energy or resting enough to support their training. And usually that looks like taking a step back, right? And then as far as acute injuries like traumas, you'll see, the ankles, the sprained ankles, the sprained knees, stuff like that, or sprained ligaments in the knees. Um, uh, but it's a lot of fractures too in kids. And oftentimes those do involve growth plate injuries, which isn't a huge deal. I feel like when we were young, at least when people used to say growth plate injury, people would really panic a lot. And most of the time kids are really they bounce back really quickly. They're pretty amazing, which is why they're so fun to treat. But you do have a lot of fractures and growth plate injuries that I treat as well with athletes.
When you treat kids, how are they able to tell you kind of what hurts? I just imagine that would be really difficult. Or how can parents kind of tell if their kid, I mean, I guess you can tell if a kid is injured, but sometimes they're just
Yeah,
are kind of
it's a good
confused.
question. I found it's either one or the other. Like either the kid is gonna be like, my knee hurts right there. This is what happened, right? Or they're gonna do the look where they look at their parents, and mom's gonna have to be or dad is gonna have to be like, well. they kind of fell, and then afterwards, they didn't say anything, they played through the game, and then they were limping here and there, and those are actually really important signs. There's little things that you pick up on, but kids don't usually limp, and kids don't usually know how to fake limps. So if you notice your kid is limping after a fall in a game or something, most of the time there's something going on there.
Fake limp. Oh, I was the best at that. A good old fake limp to get me out of conditioning. Okay, awesome. So the Surfside Sports Med is at Surfside. Do
Yeah.
you want to just remind the days and walk-in hours maybe?
Yeah, so I am there starting the 27th. And we are going to be 8 to 4. We're accepting patients. I see ages 2 and up. And we, yeah, accept walk-ins right away. So, especially acute stuff like fractures and things like that, especially kids because they heal so fast. I love to see them right away.
That's it for this episode of Happier Healthier. We appreciate you tuning in and hope you gained valuable insights for your health journey. Again, thank you to our sponsor, the CMC Foundation, for allowing us to bring you this information from experts for free. Discover more about the CMC Foundation's vital work in our community and how you can contribute to their mission by visiting cmcfoundationsc.com. That's cmcfoundationsc.com, or find the link in our show notes. And just as a reminder, all content discussed on CMC's Happier Healthier podcast are the individual opinions of our hosts and guests and should not be construed as personalized medical advice. By listening to this podcast, you agree not to use this podcast to treat any medical condition for either yourself or others. Consult your own physician for any medical issues you may be having. This disclaimer applies to any guest or contributor to the podcast. Be sure to subscribe so you don't miss our next episode of Happier Healthier, proudly brought to you by Conway Medical Center.